Welcome to English Mystery. Today, we're tackling a topic that makes many people nervous: seeing a doctor in an English-speaking country. Why do you think visiting the doctor can be so intimidating for language learners?
Great question. The anxiety often stems from fear of not understanding medical terminology or worrying about describing symptoms accurately. For example, even native speakers sometimes struggle to explain pain or discomfort, so adding a language barrier can make it doubly stressful.
Absolutely, and on top of that, medical environments can feel formal and fast-paced. That pressure doesn't help. Are there any studies on how language barriers affect healthcare experiences?
Yes. In fact, a 2017 study in the Journal of General Internal Medicine found that patients with limited English proficiency were 25% more likely to misunderstand medical instructions, which can affect treatment outcomes. That's why practicing key phrases is so important.
So, it's not just about vocabulary, it's about effective communication for your own well-being. Let's move on and walk through what actually happens from arrival to consultation. Before you even see the doctor, the first step is talking to the receptionist. What's the best way for someone to start this conversation in English?
A polite and standard phrase is, "I'd like to make an appointment, please." This simple sentence signals your request clearly. Receptionists hear it daily, so it immediately sets the right tone.
That's straightforward. Suppose the receptionist asks for your details. What information do they usually need?
Typically, they'll ask for your full name, date of birth, and sometimes the reason for your visit. It's helpful to practice spelling your name or stating your symptoms briefly, like, "I have a stomachache."
Some clinics might use online booking, but face-to-face or phone appointments are still common. Do you have tips for handling misunderstandings at the reception desk?
If you don't understand a question, it's perfectly okay to say, "Could you repeat that, please?" Or, "I'm sorry, I didn't catch that." This shows you're engaged and helps prevent confusion later in your visit.
Let's transition to the consultation itself. Once you're in the doctor's office, what's the most effective way to explain your symptoms, especially if you're not familiar with medical jargon?
Simplicity is key. Use clear statements like, "I have a stomachache," or "I don't feel well." If possible, describe how long you've had the problem. For example, "I've had this pain for 2 days." This helps the doctor understand urgency and context.
That makes sense. Sometimes people worry about forgetting words. Can analogies or gestures help clarify symptoms?
Absolutely. If you can't remember dizzy, you might say, "I feel like the room is spinning." Gestures or pointing can supplement your words. Doctors are skilled at interpreting descriptions, so don't hesitate to explain in your own way.
Let's say the doctor prescribes medicine. What should you do if you don't understand the instructions?
Politely ask for clarification. "Could you explain how to take this?" Or, "Can you write it down for me?" According to a 2022 CDC report, nearly half of patients misinterpret dosage instructions, so double-checking is always wise.
Now, as we wrap up, let's discuss how listeners can build confidence for real doctor visits. What are some practical ways to practice these conversations?
Role-playing is incredibly effective. Try practicing with a friend, or simulate both roles yourself. There are also language learning apps that focus on medical scenarios, allowing you to hear and repeat common phrases until they feel natural.
That's helpful. Are there cultural expectations patients should be aware of in English-speaking clinics?
Yes. For example, punctuality is valued, and privacy is respected. You can always ask for clarification or request a translator if needed. It's normal to take notes during your visit, or to ask for printed instructions.
Before we close, could you summarize the key phrases listeners should remember for doctor visits?
Certainly. Key sentences include, "I'd like to make an appointment," "I have a headache, stomachache," and "Can you repeat that, please?" Mastering these basics will make your next clinic visit much smoother.